You've heard the stories of pets sniffing out cancer in their human. You may remember Tara Leonard, her dog Willow here, jumped on her bed, put her nose into Tara's side. When Tara wiped herself off, she felt a lump, and it turned out to be breast cancer. Doctors caught it in time. Now Tara is cancer-free.
There's also the story of Fidge the cat. Her human, Wendy, says Fidge jumped on her chest every night for 2 weeks. Wendy went to the doctor because she was bruised and learned she too had cancer. Wendy credits Fidge for saving her life.
Your smell can also be an indicator of trouble, and dogs can pick up on that too. These dogs are trained to sniff out ovarian cancer through breath. Some of these cancer-detecting dogs can be up to 99% accurate. Isn't that amazing?
It is.
But it's not just our pets. Enter the pigeon.
You heard him right. As it turns out, those bird brains may be quite brilliant.
Ask just about anyone on the street what they think of when you say pigeon.
Droppings.
Yes, they can soil your car, but what if I told you new research says they can also accurately spot breast cancer?
No, it is not a joke.
Researcher Richard Levinson wondered how well pigeons could see cancerous cells in tissue samples. Researchers put pigeons in a box and showed them a bunch of different slides.
The pigeons were then asked, with some encouragement, is this a cancer image or a normal image?
If they guessed right by tapping a touchscreen with their beak, they got food, and this was done over and over again. Levinson says eventually the birds were able to learn what cancerous cells looked like, not because they care or wanted to be doctors, but because they wanted food. In fact, their accuracy was about the same as when human doctors looked at the images. Levinson says pigeons are really quite smart. Well-known psychologist B.F. Skinner knew that. He rewarded pigeons with food and similar tests that was able to get them to do amazing things, like play ping pong.
If it goes past one pigeon, the other pigeon can eat.
They can actually tell the difference between different French modern artists like Picasso and Matisse.
Levinson says his pigeon research could help us humans learn how to study cancer cell slides better in the future, and adds, if anyone ever calls you bird brain, don't get mad.
I would take it as a tribute.
Add this to all of that, a pigeon's brain is smaller than a walnut, and yet it can also be trained to detect a human's emotion, even misshapen pills.
That's incredible.
It is.
Absolutely amazing.
So you're diagnosed. The next step is to begin treatment.
There is a new tool that some are using to treat patients. It's called a margin probe, and it's decreasing the number of return trips to the operating table.
That's incredible.
Dr. Nancy Marquez is talking about this device.
It's one of the few things that's happened recently that has really made me excited about implementing the use for my patients.
Developed 10 years ago in Israel, the margin probe is now approved by the FDA for surgeries to remove cancerous tumors. And in the case of breast cancer, it's lowering the need for additional surgeries by over 50%.
In a matter of a second, it'll give us a reading if it's positive or negative for cancer cells.
In years past, surgeons would remove tumors and send to their labs to test the edges or the margins for microscopic cancer cells. The problem is the testing can take days.
If any one of those margins has cancer in it, we have to go back and take more tissue out.
But the margin probe can be used while the patient is still in surgery.
The device has suction in this, and we apply it to the tissue.
And in a matter of minutes, the surgeon will know if more tissue needs to be removed.
And that saves a whole nother operation for a woman.
Only a small number of surgeons nationwide are using this device. One reason is the cost. Many insurance companies will not pay for the probe that can cost more than $1,000.
If you can't get reimbursed for the cost of the probe, it's hard to really incorporate that in your day-to-day surgeries.
That reason is why Dr. Marquez has only used the device a handful of times on breast cancer patients, but she's hopeful insurance companies will come around.
If I can save them a trip to the operating room and all the potential inherent complications of going back to the operating room, it's a great deal for my patients.
Studies have shown that when the margin probe is used with a pathologist exam and ultrasound, the rate of tumor cells seen at the edges of the removed tissue cut in half. Now, despite all the advances in detection and treatment, 1 in 8 women will be diagnosed with breast cancer, and many survivors will need reconstructive surgery.
And that surgery can leave some women doubting their confidence and beauty, until now.
The day before her 28th birthday, Dana Donofree heard the words, "You have breast cancer."
I was completely devastated. My world changed completely in that day.
First, the trauma of a double mastectomy, then the stark realization that her old bras were worthless.
Why am I so emotional about this, and why do I let this affect my day? I should try to do something about it. Maybe there's something to be done here.
So last year, Dana did something no one in the world had. She started the first company making bras just for breast cancer survivors, cleverly called Ana Ono Intimates.
A lot of it is my name without the double D's.
Sales are up 300%, and the demand from around the world just keeps growing. Thousands of women are buying her bras online, and they're sold in specialty boutiques here in the U.S. and even Ireland.
I'm not just selling a bra, I'm selling confidence, beauty, strength, and anything else that makes you feel good about yourself.
It was just incredible. There's nothing, I have a hard time finding words for it because it was just amazing.
Donna Free uses real-life breast cancer survivors as models for each design she makes.
The confidence that I felt after participating truly was life-changing.
A growing global business changing one life at a time.
Cheers!
And Dana plans to start selling bathing suits and loungewear next year. 5% of all Ana Ono sales go to breast cancer foundations.
Turning something bad into something good.
Yeah, very nice.
Wow. Well, you know, staying in shape can go a long way in keeping you healthy. Still ahead, we're building muscle. You're going to hear which foods can get you toned.
And you have to get moving too. We show you what could be the perfect spot to keep the entire family active. Delmarva Life, we'll be right back.